So, Daktari, welcome. You can go on and share with us what you've prepared for us. And of course, we appreciate your sacrifice and time. Thank you.
Okay. So good evening, everybody. You're most welcome
Good
to our
evening.
presentation for today. This one is called the Fertility Education Webinar for Linda Vijana Initiative. And Wastahili Family Wellness Center is the name of my organization. And I would like to just give a brief background about how Wastahili Family Wellness Center was started by myself in 2018. My name is Ada Tatu, medical doctor, and our motto and core values are: when solving problems, we dig at the root instead of just hacking at the leaves. And we believe in the sanctity of life and the respect for the dignity of the human person from conception until natural death throughout the human life cycle, and that human rights come from human dignity. And we believe in integrity, professionalism, excellence, teamwork, and social responsibility in empowerment by speaking the truth. Okay, so it was born out of a need to approach health not from a politically correct perspective, but from understanding the design of the human person as the creator intended and knowing how deviations from that result in sickness. For example, the World Health Organization, as we speak, says that abortion is healthcare, yet abortion is defined as the deliberate killing of the preborn person. They talk about an unmet need for contraception, but they never talk about the unmet need for natural family planning. Women are suffering from the adverse effects of artificial contraception, and sexual and reproductive health and rights ideology advocates for the use of artificial contraception from the age of 10. So since we don't subscribe to this, and nutrition and natural family planning were not taught in medical school, it was more or less one kind of sentence, and we were told that it does not work. So the emphasis is trying to enrich the pharmacological agencies and training us mainly on how to give drugs. So those are the services we give at Wastahili: counseling, fertility education, natural family planning, crisis pregnancy, post-abortion syndrome healing, character coaching, and certified mediation, and counselor supervision. So last time, I think 2 months ago, last month, we talked about the human life cycle. And so in today's topic, we're going to emphasize more on the woman, although she cannot do without so far, the sexual and reproductive rights has been talking about the woman as if she's the only person concerned in her reproductive health. But obviously the woman and the man are supposed to be complementary. So this is the human life cycle that we discussed, how the two get married according to God's plan, God being at the center of everything. And then their marital relations, the marital act should, if it's fruitful, it results in a baby who grows, and he's supposed to grow in a natural family with a mother and father. And then there are many families form part of the community, and from the community you get the next husband and wife. So this is all about the human life cycle, which we already discussed. And we believe in creation, because the human life cycle that was given to us before was always removing the cock. So we didn't know there was a misrepresentation of the fertility of women, the reproductive health of women without the male. So we'll define health, reproductive health, medicine, natural family planning, and informed consent. Health is the complete physical, mental, family, spiritual, and environmental wellness, and not merely the absence of infirmity. So this was discussed at the Vitae Familia conference in 2019 to be a more complete definition of health, because the World Health Organization definition of health doesn't say anything about family, spiritual, and environmental health. And yet all the scientific studies have shown that the family is the basic unit of society, and most of the problems in society can be traced to dysfunctional families. And spirituality is very important for our health and environment. So we will go by the Vita et Familia definition. Reproductive health is the same definition, and not merely the absence of infirmity in all matters reproduction. Medicine is the study of the diagnosis, treatment, and prevention of disease, and pregnancy is not a disease, and therefore contraceptives are not medicines, but drugs. And so they were not allowed within any kilometer radius before 1985 of any hospital. And hormonal contraceptives have been classified as class 1 carcinogens causing cancer by the World Health Organization in 2005, in the same class as asbestos and tobacco. So it's part of the eugenics agenda of reducing the undesirable races in the world. And in 1985, they finally convinced Kenyatta Hospital to have a part which of the hospital for what they call family planning, which is just basically distributing contraceptives and in exchange for free vaccines. Natural family planning is part of fertility education and care, which is a form of birth spacing that respects the natural anatomy and physiology of the human body. Therefore, it doesn't have any adverse effects. Informed consent is an essential component of health. And this involves making a health decision after learning about and considering the available options. Women are not being told about the adverse effects of contraceptives, and the ones who ask for natural family planning are being told it doesn't work. And so less than 3% of women know about how their body works, according to RHRI. And this makes women unable to make the best healthcare decisions for themselves. Then there's also a lot of shame and stigma around menstruation, yet it's the most natural thing that happens to women. And so the true empowerment of women are those who are educated about the fertility cycle so that they can take charge of their total wellness and fertility goals. So I'm a fertility education coach with fertility education and medical management called FEM, and it looks at natural family planning and health. So we look at the female reproductive system, the anatomy, which is the structure, and the function. Function is called physiology. So we look at the external and the internal body parts. Most of the reproductive system of a woman is actually on the, sorry for not showing, I've just realized that I wasn't on video. It's actually between the belly button and where the legs part. Inside most of her reproductive organs are on the inside, unlike a man whose reproductive organs are on the outside. And yep, so that's the female reproductive system. And as you can see, this is the uterus, and it's about the size of a woman's fist before she gets pregnant, which can expand to many times the size of her fist as the baby grows inside of her. The upper part of the uterus is called the fundus. Then on either side, you have the two fallopian tubes, which end up in the ovaries. And this is where the eggs are released. Every woman, baby girl, is born with 1 to 2 million eggs, but she'll end up releasing about 500 of them. And so they travel down the tube, and this is where they're fertilized. This is the vagina, which opens to the outside and is the recipient for the penis of the husband. And this is the cervix, which is the lower part of the uterus, a hollow muscular organ that is normally closed. And the inside of the vagina is not sterile and it's acidic. The inside of the uterus is actually sterile, which means it doesn't have any bacteria. It's not supposed to have. Yeah, so these are the fimbriae. These are the what they call the fingers that grasp the ovary when it's released. into the fallopian tube, and the egg is usually fertilized in the fallopian tube, and it travels down and implants into the uterus. So the whole structure of the woman and women is to, her physiology and anatomy is to produce an egg every month, and to make, that is called ovulation, so that, and then to prepare for the implantation of the fertilized egg, which is a newly formed human being. Yeah, so we've talked about the uterus, the womb. The endometrium is actually the lining of the uterus here. This is the lining of the uterus where the baby implants after fertilization. The cervix is the neck of the womb, the fallopian tube, ovaries and eggs, and the vagina is the opening to the outside. Okay, so that is what it looks like from, this is what it looks like from front to back. The front is the urethra, the middle is the vagina, and behind is the anus, and that is how it is in the lithotomy position of giving birth. So the tube conveying the urine from the bladder to the outside of the body is called the urethra. And for women, the anus is in close proximity to the urethral and vaginal openings. And so this anatomy is important because women will understand, will be able to identify their cervical secretions to know what hormone is working when. And they should always wipe from front to back to avoid introducing bacteria which can cause infections. And so women are very susceptible to infections around that area. What they call UTI, urinary tract infections. And the richness of the nerve endings, that means women who are blind are even able to identify what kind of cervical mucus they are producing. So they can also use natural family planning. Yeah. So the ovulation cycle, the fertility cycle has 4 main hormones. A hormone is a substance that is produced in the by an organ in the blood, and then it is sent into the bloodstream to affect another distant organ. And the two main organs that we're thinking of here are the brain and the ovaries and the uterus, 3 main organs. So the follicular stimulating hormone and the luteinizing hormone are from the brain. Estrogen and progesterone are produced by the ovaries. Therefore, if you see a woman ovulating, it's a sign of good health, because it means that because these hormones work in a cascade, that means that they're all functioning well. Yeah. So let me first go to the next picture. So the hormones, follicular stimulating hormone and luteinizing hormone, from the brain of the lady, stimulate the ovaries to develop an egg and produce the hormones estrogen and progesterone. So you can see FSH and LH are released into the bloodstream. Estrogen and progesterone influence reproductive and general health. Yeah. So you have the gonadotropin releasing hormone, which acts on the pituitary gland, which is at the base of the brain. And the pituitary gland releases 2 hormones, FSH, follicular stimulating hormone, and LH. Both of them enter the bloodstream and have effects on the uterus and the ovaries. So these hormones stimulate the ovaries to begin producing 2 more hormones, estrogen, which is produced by the growing follicle, and progesterone, which is caused by produced by the corpus luteum, which I'll show you later. Yeah, so fertility education and medical management focuses on those 4 hormones, although actually there are actually over a dozen hormones that play in each cycle, including the thyroid hormone and insulin. So since these hormones act in a cascade, that means that if a woman ovulates, that means all these hormones are healthy. So ovulation is a sign of health. And the main idea is to help women to come out of that mindset of menstrual cycle. The main thing that happens The most important event is ovulation, not menstruation. Menstruation is actually the end. So balanced and healthy hormonal function is vital to reproductive and overall health. So here you have in this slide showing the different functions of estrogen and progesterone. And you find that the main function of estrogen is to build up and grow, and progesterone is to stabilize. So in the uterus, the estrogen causes it to contract and be toned, and progesterone relaxes. The lining of the uterus, called the endometrium, the estrogen causes it to grow, which is another meaning of proliferation, and progesterone maintains it. That's why women who don't have enough progesterone will tend to have miscarriages, because they're not able to maintain the pregnancy. The breast tissue, estrogen makes it grow, proliferates, and progesterone normalizes it. The bones, estrogen causes bone formation and progesterone maintains it. The blood vessels, estrogen dilates and increases flow, and progesterone relaxes. Blood clotting, estrogen causes increased blood clotting, and progesterone normalizes. Estrogen causes raised blood sugar, and progesterone normalizes it. Estrogen causes fluid retention, and progesterone causes the fluid to be removed. That's called a diuretic. And estrogen stimulates the brain cells, and progesterone maintains it. And estrogen promotes well-being in normal levels, but in high levels increases anxiety. And progesterone produces sleep and relaxation, decreases anxiety. So you see, these hormones that are being produced are very, very important for our health. And when you mess them up in any way, for example, bad lifestyle, diet, lack of sleep, lack of exercise, hormonal contraceptives, you find that all these systems are destroyed, which we'll come to later. So hormonal insufficiency leads to health problems. And so abnormal ovulation levels result in faulty or no ovulation. So you get all those adverse effects of insufficient hormones. So when hormones are imbalanced or insufficient levels, women may experience bleeding disorders, pain, infertility, polycystic ovarian system, endometriosis, mood changes, anxiety, premenstrual syndrome, anemia, acne, weight gain or loss, and other conditions and symptoms. So lifestyle is very important for our health, diet, weight. So people need to measure their basal metabolic index to know what weight is good for your height. And then exercise at least 30 minutes 3 times a week, preferably 5 days a week. Walking minimum. Sleep habits, you need at least 7 hours of sleep. If you're an adolescent, actually you need 8. Then we need to manage our stress levels and avoid smoking, alcohol, drugs. We're also affected by medical conditions and treatment and hormonal contraceptives. So we're going to talk about the fertility, the ovulation cycle. And this picture describes it more. This is fertilization and implantation of the fetus at 10 weeks. So this is a very big sized ovary, and this is the edge of the uterus. Here you find, it's a picture of a growing follicle and all the way to when it becomes a corpus luteum. So this is a follicle, an egg which is growing inside a sac is called a follicle. And follicular stimulating hormone from the brain goes and affects the ovaries to make it grow like this. And as the follicle is growing, it's producing estrogen. And then it grows bigger and bigger and bigger until it releases the ovary into the edge of the fallopian tube, where it is fertilized by this sperm, as you can see here. And then when it's fertilized, it starts moving down the tube in 4 to 5 days. And then on the 6th, as it continues to divide, by that time it's called a morula. And then it becomes a blastocyst. And then it implants into the uterine wall. And from the time it implants into the uterine wall, it is called an embryo. And then as soon as the baby implants into the uterine wall, it produces a hormone called HCG, which is then the woman is prevented from getting another menstrual period. So she realizes that she's pregnant, and a positive pregnancy test is HCG, which is produced by the baby. And then, so once the follicle releases the egg into the lateral part of the uterine wall, the lateral part of the fallopian tube, it changes into corpus luteum that starts producing progesterone. And then if there's no pregnancy, it will just degenerate and the period will come. If there's a pregnancy, the HCG sends a message to the corpus luteum to continue producing progesterone for the next 3 months. And then when the 10 weeks to 12 weeks are over, the uterus will take over the production of progesterone. So you can see everything is very much in harmony. And so that FSH stimulates an egg to grow and produce estrogen. Then estrogen at peak levels stimulates luteinizing hormone from the brain. The luteinizing hormone triggers the mature egg to ovulate, and the egg bursts out of the ovary into the fallopian tube. The eggshell left becomes a corpus luteum and produces progesterone, and progesterone is produced by the corpus luteum after ovulation. So, yeah. So that's what ovulation looks like, is when an egg is released from one of the 2 ovaries and travels down the fallopian tube, where fertilization by a sperm can occur. So, yeah, so that is life beginning at conception. And you find that there are many, many sperm that are released, millions of them, but only one of them will be allowed to fertilize this egg. And so the sperm has 23 chromosomes from the father, the egg has 23 chromosomes from the mother. And as soon as the first one enters, all the others, the egg develops a shell and no other sperm can enter. So that is the beginning of life. And then it becomes a 46 chromosome cell, which is the beginning of life, which is a completely new person. It never existed before, does not exist, and will never exist again. So it's a unique person, and life begins at conception. So hormones and rise and fall in the cycle, I think I've given you an idea. A healthy reproductive cycle requires each hormone to reach proper levels to stimulate the release of the next hormone. So the fact that ovulation occurs means that each hormone in the sequence has reached healthy levels. So this is follicular stimulating hormone. This is the beginning of the menstruation. That's when we start charting the cycle. And then here is the beginning of the next menstruation. So this is how follicular stimulating hormone looks like. You can see that there's a peak there mid-cycle. And it's important to know which hormone is happening because the cervical mucus changes accordingly. This is estrogen. You find that mid-cycle, the estrogen is actually very high, then it falls again, and then it rises again in the second half of the cycle. So the luteinizing hormone is the one that triggers the mature egg to ovulate. You can see mid-cycle, there's a very big spike, and then it falls again. And progesterone is produced in the second half of the cycle, and is produced by the corpus luteum. So this is now what they all look like together. So this is FSH, stimulates an egg to grow and produce estrogen. You can see the egg growing there. And then the egg, as it's growing, is producing estrogen. And then estrogen stimulates luteinizing hormone from the brain. And then when estrogen levels are very high, The luteinizing hormone triggers the mature cell egg to ovulate mid-cycle. We were told that we all ovulate on the 14th day, but that's not true. Women have different days when they ovulate. Some women have 21-day cycles, others have 36-day cycles. So progesterone is produced after the ovulation. As you can see, after the egg is released from the follicle becomes a corpus luteum. And then if the pregnancy doesn't happen, it degenerates and the next cycle appears. So women are actually only fertile for 4 to 6 days a month. Yeah. So what we call biomarkers is something that will tell us what hormone is working. For example, if you go to hospital, the first thing they do is something called a triage. That is called, for example, your blood pressure, your respiration rate, your heart rate, you know, your blood pressure. With those 4 signs, somebody can immediately know how sick you are. So the same way biomarkers, we usually use the cervical mucus that I was describing that will come out through the vagina, and the woman will be able to recognize what hormone is working at what particular time. So this is the beginning of the cycle, and that's the end of the cycle. The first beginning of the cycle, we usually use a chart, and this is called menstruation, when the uterine wall is being shed because there was no pregnancy. Therefore, it's kind of wasted. The blood starts being shed as menstruation marker, which means that menstruation is occurring. Then usually after menstruation, there's a dry period. And that means that estrogen levels are low and progesterone levels are low. We mark it as gray. And it usually means there's a mucus plug there. And that's what it looks like on the microscope. And then after some days, we have the woman starts noticing some moisture, and we call this the point of change. So Makamasi-like substance which comes out through from the cervix into the vagina, and you can see estrogen levels are rising here, and the uterine wall is starting to grow. So we call this the point of change, when she starts noticing mucus after a period of being dry. Although you'll realize that some women don't have a dry period, but majority do have a dry stage before the mucus. And this shows that now she's becoming fertile and her estrogen levels are rising. Then usually after a couple of days, the mucus becomes very slippery, much more in amount, and stretchy, like egg white. And this is estrogen levels are very high. And this is fertile mucus, which you can see on microscope. It's a highway to a passage, and it has a lot of nutrients for the sperm and straight passage towards the egg in the fallopian tube. And then after some time, the woman suddenly notices, you can see the uterine lining is also becoming thicker and thicker. And then after some time, the woman just notices suddenly that she's dry. That means that the last day this is ES mucus and this is EL mucus. The last day of ES mucus is called the peak day, and she's most likely to have ovulated around the peak day. Then after that, she becomes dry. So these are biomarkers which can tell what hormones are at play at any particular time. This is the kind of chart we have. So in this slide, you see 1, 2, 3, 4, 5 days of menstruation, followed by 1, 2, 3, 4, 5 days of dryness, followed by 2 days. This is her point of change when she notices moisture. And then that's ES mucus, EL mucus for 2 days. It's wet, it's moist, but it's like Makamasi, it's still thickish. You can't see through it. Then all of a sudden it starts getting thicker and not thicker, more and more slippery, and more in amount, and more clear. So this means you can see her estrogen levels are very high. And then suddenly she becomes dry. after ovulation because the corpus luteum is now producing progesterone. Progesterone makes the cervical mucus thick and dry. So all these days, she's actually dry. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So this is called the luteal phase, and it should be 9 to 18 days long, which means she has a healthy corpus luteum and she's able to maintain a pregnancy. This is called the ovulatory period. Yeah. And this is called the pre-ovulatory period, and this is called the post-ovulatory period. So ovulation usually occurs mid-cycle. So just by looking at her cervical mucus, she's able to tell which hormone is predominant at any particular time. All right. So in natural family planning, men and women are supposed to be complementary to each other and not in competition. Yeah, so you find that the same hormones that stimulate the woman's reproductive system are the same ones that stimulate the male reproductive system. The brain signals the testes to produce sperm, and the male hormone is testosterone. So testosterone influences reproductive and general health also. And yeah, so that's the female organ, reproductive system that we have seen. And this is the male reproductive system from the side view. You can see the penis is in front, and you have the testicles behind here, which contain the epididymis that produces sperm, and these enter the vas deferens, and they pass around the bladder, and they're containing the sperm that have been made in the testes, and then they're nourished by the seminal vesicle and the prostate gland before they enter into the penis. So then you have the bladder, which produces urine, and the colon behind. So the same urethra that delivers urine is the one that delivers the sperm, but never ever at the same time. So natural family planning benefits is that it respects the natural physiology and anatomy. It empowers the woman to understand her fertility cycle and gives informed consent. It encourages communication between the couple and reduces the divorce rate and enhances the quality of the marital union. We'll go back to that in a while. Just wanted to give a brief overview of artificial contraceptives. Contraceptive means against life, contra is against, and ception is life, conception. So it's very difficult to understand about the contraceptives unless you understand the anatomy and physiology. So I'll just try to go through them quickly. There are 7 main groups. One is the hormonal contraceptives. Actually contains they're synthetic hormones that trick the body that it's pregnant, so that follicular stimulating hormone and luteinizing hormone are not produced. And they also include Depo-Provera and the implant. So actually this is one group. Then you have a second group, which is the intrauterine contraceptive device. Then you have the barrier methods, condoms, diaphragms, which try to prevent the sperm from meeting the egg. Then you have the sterilization surgeries. Actually, we did touch this last month. And you have the anti-fertility vaccine. So the woman who is empowered knows about the mechanism of action, the failure rate, and adverse effects, which are all in the public domain. So you have the hormonal contraceptives, which are many. You have the oral contraceptive pill, the morning after pill, the subdermal implant or no plant, Depo-Provera injection, intrauterine system, which is a coil with a hormone in it, a transdermal patch, which is put on the skin and absorbed through the skin, and a combined vaginal ring. And that's probably what the pills look like. And a woman is supposed to swallow them every day. Some of them have a break of 7 days during the month. So the 3 ways in which the pill works It inhibits implantation of the newly formed child, so it's abortifacient. It prevents ovulation. It thickens the cervical mucus and delays the ovum and sperm transport by affecting the cilia in the fallopian tubes. So they trick the body, like we said, into a pregnancy-like state. So the hormones that were supposed to have fallen, they don't fall. So you just have something synthetic there. So the brain thinks that, oh, we're pregnant. So it doesn't produce follicular stimulating hormone. So yeah. So that's how the pill works. It inhibits implantation, delays or the ovum and sperm transport, inhibits ovulation there, and thickens the cervical mucus. So many women think that it just prevents ovulation, but no, they have those 3 mechanisms of action. Have many adverse effects, which they are class 1 carcinogens. Like we said, they caused cancer like tobacco and asbestos of the breast, cervix, liver. And with abortion, then there's a multiplier effect when you have had an abortion and also use contraceptive pills. So they prevent implantation of the zygote. They cause emotional changes affecting the mood. Like we said, estrogen and progesterone are very important for the mood. And so they do cause depression, which is much worse in adolescence, irritability and low libido, high blood pressure, increased clotting, which can result in deep vein thrombosis, stroke, pulmonary embolism, and death. We've seen women suffering from these things. Nausea, vomiting, and painful sex due to thinning of the vaginal wall, and also skin problems. And by suppressing the pituitary, it affects the thyroid gland and the other hormones. So then you also have P2 emergency contraceptive. Basically, most of the hormonal contraceptives will have the same effects that I've said there. So P2 is an emergency so-called contraceptive pill. It's abortifacient 85% of the time and prevents conception. It's given over to the counter to underage girls, which is criminal, and it's also given to women without a prescription. Some of them may be having an ectopic pregnancy, in which case she will die due to bleeding. So 1 tablet contains the equivalent of 25 contraceptive pills, and since she needs 2 pills per dose, she swallows the equivalent of 50 pills. So she's supposed to use a maximum dose of twice per year in case of emergency, but she's being abused to the tune of 52 times per year every Monday. There's some women who go for this, especially university students. They're not informed about the toxicity. So all those adverse effects that we talked about, the pill, are also here. And it's abortifacient, so it causes cramping and severe abdominal pain. And so we go to Depo-Provera, which is given every 3 months. It's called the shot. And the adverse effects of Depo are that it causes irreversible bone loss, and it causes increased susceptibility to STDs like gonorrhea, chlamydia, and HIV due to changes in the mucous membrane. And the woman who has it is at higher risk of transmitting HIV to her partner. Can also cause breast cancer, weight gain, menstrual irregularities, abdominal pain, dizziness, headache, and decreases the sex drive. All those other effects, fatigue, nervousness, backache, depression, bloating, nausea, rash, insomnia, joint pain. So all these things, adverse effects, are in the public domain, but women are not being told. And apparently the health workers are very friendly when they're giving them these medications, but not very friendly when the women come back with the complications. So you have the contraceptive implant, which is put in the upper arm. And there's a series of rods and capsules which are inserted into a woman's upper arm. You can imagine they release artificial contraceptive for the next 5 years. How toxic is that? It also prevents ovulation, thickens the cervical mucus, and changes the lining of the uterus, causing abortion of conceived babies. Irregular menstruation, headaches, fainting, ruptured liver tumors, heart attack, stroke, gallbladder disease, skeletal pain, and nervousness. So you have all these adverse effects, which you can see there: blood clotting, yellowing of the eyeballs, coughing blood, hair loss, weight gain, acne. Then you have the birth control patch, which is applied on the skin for 3 weeks with a break of 1 week, and then start the cycle again. All the adverse effects of the other hormonal contraceptives are experienced by this lady. And then, so there's a book you can read called Breast Cancer, Abortion and the Pill. So it's linked to abortion and the birth control pill, because when you interrupt a pregnancy artificially, you find the type 1 and type 2 lobules, which are very cancer prone. They change into cancer cells when a pregnancy is artificially terminated. Because when a woman carries her pregnancy to term and breastfeeds, you have type 3 and type 4 lobules, which are cancer resistant. But when you artificially stop a pregnancy, then you get type 1 and type 2 lobules, which are cancer prone. So this is the coil. You have 2 types. You have the hormonal coil and you have the copper coil. This hormonal coil releases a hormone and works exactly like the contraceptives, hormonal contraceptives. Those 3 mechanisms we talked about: preventing ovulation, changing the cervical mucus, and thinning of the uterine wall to prevent implantation. And then you have here the copper, which works as the copper is very irritating to the uterine wall. So you get some kind of inflammation of the uterine wall, and it's very unfriendly for the baby who's trying to implant. So they are 100% abortifacient. They do not prevent fertilization. So there you see the coil being inserted into the woman's uterus with the strings hanging out. The strings are hanging out into the vagina, and it's a very high risk of bacteria climbing up there and causing an infection, and infection in the pelvis, leading to infertility. So that's how. And then if it's very big, then it can cause perforation of the uterus if it's the wrong size, which will need emergency surgery. Or if the strings get lost, then she also needs emergency surgery. Many, many adverse effects. 100% abortifacient. The woman can have a foul smelling discharge, and she mistakenly thinks that her husband has given her an STD. The husband is also asking, where did that STD come from? So it causes a lot of problems in marriages. Then you've talked about cramps and backache, heavy bleeding due to inflammation, and alkaline is the vagina, leading to infections and ectopic pregnancy from tubal blockage. So these are very toxic. So the intrauterine system, like we said, works like a hormone and causes endometrial thinning. So now we go to permanent sterilization methods. The fallopian tubes, you can see, have been cut or tied off and cut apart. Actually, the different methods in which the fallopian tubes, this is attempting to prevent the eggs from meeting the sperm at all. So they can be cut physically. The tubes can be shut. You can also burn them and remove the tubes altogether. So those are the different methods. Adverse effects can be bleeding, infection, ectopic pregnancy. You can also damage the bowel and the blood vessels by mistake. Many women have guilt and regret when the craving for a baby returns. When the baby is a certain age, many women feel like another child. And straight after the baby, maybe they were feeling like, I never want another child. But usually when the baby is a certain age, we crave for another one. So it also causes change in sexual interest, pleasure, marital satisfaction. It really affects the sex life of these women, and they're not counseled usually. You can get 2 to 4 deaths per 100,000, especially if there's bleeding and infection. You can also get painful intercourse, menstrual dysfunction, post-ligation syndrome, which is so painful. Sometimes she may actually need to have the tubes removed. Then vasectomy is for the gentleman, and we already talked about the vas deferens that carries the sperms from the testes into the bladder, into the seminal vesicles, the prostate, and into the urethra. So it's the vas deferens, the tube that is cut. And it's effective, and can be surgically removed or clamped shut. The problem is that the man's testis continues to produce millions of sperm with no natural way of release. So the pressure of the backed up sperm causes a blowout of the epididymis and testicles, which can result in severe pain. And also some of the sperm cells, that backlog, artificially blockage, the sperms can enter the bloodstream and cause an antibody reaction. And so they can also get a lot of regret, and reversal is extremely expensive, much more expensive than the operation itself. They always make it sound like it's very simple. And actually people can die from the antibody antigen reaction. People have died from that kidney reaction. So you have the barrier methods, the male condom, which is always touted to be, like the answer to everything, what they call safe sex. And that one is for covering the male organ. It attempts to block the male seed from entering the female. But if a woman is in her fertile stage, it doesn't block anything, because the spermatozoa, even from the thigh, can actually fertilize the egg. If the cervical mucus is fertile, condoms will not do anything. And also if the human papilloma virus, which is shed from the scrotum, the condom doesn't cover the scrotum. So this whole idea of safe sex, there's so many diseases which are passed from the scrotum which are not covered by the condom. Okay, some couples complain of altered sensation. Definitely it separates husband and wife. Some people get allergic reaction. They can slip, they can tear, they can break. And of course, latex rubber degradation in warm climates and being kept in the pocket lowers the efficiency. Then you have the female version, the female condom, and you can see the way that it's exerted. There's a closed end and an open end, and the open end is where you can see the finger passing. Yeah. Also, cannot go without talking about the anti-HCG vaccine. This was discovered by the Kenya KCDA, Kenya Catholic Doctors Association, and it was found in a so-called tetanus vaccine in 2014 and in 1993, and it caused abortion. So it was introduced as a family planning method, and so the women, it was attached to the tetanus vaccine, and you found that the women were actually making antibodies to their own children. And so this was a crime against humanity, because the baby, as soon as it tried to make the HCG, it was aborted by the mother without her knowledge. And this was a campaign that was being greatly publicized by the World Health Organization, and many women became sterile. So that was a crime against humanity, which was discovered, and then people just went quiet about it. So can talk about the failure rate. So every contraceptive method has a failure rate. They talk about preventing pregnancy, but it's actually just reducing the chance of pregnancy. Prevention is actually just something that is there to deceive people. There's no method that's 100% effective. So there you have the 12-month failure rate, then you have the perfect use failure rate, and the 12-month discontinuation rate. So I won't go through them. Maybe we can refer to them. For example, the male condom has an 18% 12-month failure rate, and this is being given to the youth as if it's an answer for everything and the so-called safe sex. So it has a very high failure rate. And so those are the other methods. So the conclusion on contraceptives is that they shield our eyes from the incredible gift and beauty of the female body and its fertility. And by using contraceptives to tamper with their bodies, women are not empowered but enslaved. They're actually just benefiting the big pharmaceutical agents. You've seen that women are only fertile for 2 to 6 days a month, and yet she's expected to swallow a pill every day, or be injected every 3 months, or have this implant in her body for 5 years, or a coil for 10 years. So they call it family planning, which is a euphemism. It's actually has nothing to do with families. They give it to university students. They advertise it openly to women who are not married. So it's actually something which has destroyed the health of so many women. So yeah, I continue saying, you know, we've said this, women are only fertile for 4 to 6 days in a month. And 3 days after the egg is released, she's completely infertile before she goes to the next cycle. So childbirth spacing in natural family planning observes the periods of abstinence from sex during the woman's fertile phase. So we use indicators to identify the beginning and the end of the fertile phase. Modern natural family planning methods are as effective as the most effective artificial methods. So women who know how their bodies work and cooperate with the process are much more confident, healthy, and strong. The modern natural family planning methods include FEM, what I've taught you, and NAPRO technology using the Creighton model. Others include Billings ovulation, symptothermal method, where a woman measures her temperature and her cervical mucus. Usually a woman's temperature goes up straight after ovulation for some time, but that is very tiring for some women to measure their temperature. Then you have the standard methods, colored beans, but it has a high failure rate, especially in women with very long or very short cycles. Then you have breastfeeding, lactation, amenorrhea method. And that means a woman is, especially if she's completely breastfeeding, 100%, she's very unlikely to ovulate. So advantage is cheap and effective. It respects the normal anatomy and physiology. There are no adverse effects. It encourages a communication between husband and wife. Though it requires mutual self-sacrifice, it promotes self-control and allows the couple to be independent of health workers. It can be also used to achieve a pregnancy. It respects women, and the woman is empowered to learn about her own her cycle, and it's universally acceptable. So you can see the calendar method has a very high failure rate. That's a natural family planning method that does not work at all, because it tells all women will ovulate on the 14th day. You know, it has nothing to do with actually what's going on in her body. So please don't listen to that calendar rhythm method. And so the others are very, very compatible with for example, 2 to 8 failure rate, and yet the pill is 9%. So you find that modern methods of natural family planning are very effective. So we would like people to get more into the habit of teaching women about the fertility cycle. And we find that the summary is that there's a menstruation, and then after that she's awaiting fertility. Then we call the point of change here when she noticed the moisture. And then it becomes more and more slippery, more and more in amount. And where that means then suddenly she becomes dry, and we know that's the peak day. And then she has to wait for 3 days. And then after 3 days after the peak day, fertility is over, and then menstruation starts again. And 3 days after the ovulation, she's completely infertile, because women only ovulate once a month. So the fertile period is only 4 to 6 days, and identifying that is what is really, really empowering for women. Okay, so yeah, this is more or less the cycle that we get, and we teach the women about the fertility cycle. We tell them that there should be no sex in the morning when somebody is trying to have birth spacing, because we don't know what kind of fluid was produced in the night. And no repeat sex, and then no daily sex, because she's supposed to be able, if she has sex daily, then she'll be confusing the semen for the types of mucus. So she needs 1 full day for all the fluids to come out through the effect of gravity, so that she can differentiate between semen and fertile mucus. So this is why the calendar method doesn't work. As you can see, all women are being told they'll ovulate on the 14th day. This is a woman with a 21-day cycle. She's being told she'll ovulate on the 14th day. That is a disaster. Maybe she can ovulate on the 7th day. This is what we call early ovulators. That's why they have a short cycle. Then you have a woman on the 34 days, which is a very long cycle. She's probably ovulating on the 20th day. So never use the calendar method for birth spacing or family planning. Yeah. So all children are God's gift. Then just a brief mention about Teen FM. We teach teens. This is very empowering to the teens. And the daughter's cycle affects her whole health, as is an indicator of health. It provides the necessary information to understand what's normal, healthy, and healthy at every stage of the girl's life. Can be able to detect and treat potential health issues as they arise, and treat the underlying hormonal balances. So yeah, we work together with the physicians, and these are the classes we give: the link between hormones and health, how to track hormonal health, brain development and changing emotions, lifestyle choices, health, and STIs. So Teen FM is very good for young girls, and it can start from the age of 10 to help them to be aware. It's very empowering to them. So this is the answer to empowerment of women, not just giving contraceptives. In fact, you completely shut down when you give a contraceptive to your daughter, it's actually just poisoning her for life. Okay, so health is more than not just getting sick, and a healthy lifestyle supports your health and hormones. Fertility awareness and natural family planning for birth spacing is true women's empowerment. And with that, we come to the end of the presentation. And so thank you for listening. And if there are any questions, you may ask them. Thank you for listening.
Thank you very much, Dr. That was quite beautiful. I've never seen anyone else like you able to go through over 100 slides in an hour. you stand out there.
I think it was an overdose, eh?
No, well, I think it's flowing, and the major question that was that you are answering is how to understand the fertility in women bodies, which I think is quite great. Now, people with questions, you can raise up your hand or you can type them. You can raise up your hand. I see someone has a question. What of those who bleed 8 days? What of those who bleed 8 days? I don't know what that means. You can understand that and answer maybe.
Actually, we have a normal cycle. Normal days of bleeding should be between 3 and 7 days. So if it's 8 days and it's a one-off thing, then we usually ask for the heaviness of the bleeding. So 8 days is a bit long. So it should be between 3 to 7, but also we will balance it with the how heavy it is, because there's light, there's medium, and there's heavy. A light period is a light day is when she uses probably 1 pad, and medium day is between 2 to 3, and a heavy day is between more than 4 pads or tampons. So we usually ask the number of pads or tampons, and all those are indicated on the chart. So 8 is borderline high, and we'll usually just observe her and the cycle. And so if it's 8 and it's heavy every single day, then there's a problem. Probably there's a hormonal imbalance. But if she's bleeding for 8 days and the last day is probably just spotting or just using 1 pad, then that is not anything to worry about.
I hope that reached
Has
the
that
person who
answered you?
asked. That chat was directed privately to me for whichever reason, so that it's not very public. But amesema she's fine with it, with the answer.
Okay,
Yes.
thank you.
Any other question? Any other question? There is a question here from somebody from Galaxy. My question: what is the hope for them found? I think for them who found themselves in the artificial family planning and already experiencing the severe side effects? Can the body bounce back to its normal state after stopping the artificial family planning?
Yeah, actually, what we do is we remove you from those artificial family planning, we continue to observe the cervical mucus. And you'll find that some of those methods take a much longer time to return to fertility than others. So we'll continue chatting, and you'll find that a woman who has gone off, for example, Depo-Provera, might take a long time to get back to fertility. So she might be having a lot of gray days, gray, dry. But then when she starts noticing moisture, then she will start marking light blue. That means there's a point of change, probably becoming moisture. And so it's the same thing. The body will actually bounce back to normal, but some contraceptives are more toxic than others. For example, Depo takes a much longer time for women to come back to their normal fertility, but the other ones she might bounce back faster than others. So there is a lot of hope. And it's very unfortunate that women are not being given informed consent. So the minute they realize that they're actually swallowing carcinogens, that they're swallowing toxins, then usually there's they actually cooperate, and they can start again. But it's exactly the same thing. They observe their cervical mucus, and yeah, they can be assisted. Because ovulation is a sign of ovulation is a sign of health. So you'll find that when you get 2 days of moisture, light blue, followed by 4 days, at least 4 days of dark blue, that is stretchy, slippery, and clear, then you see that, this month she probably ovulated. Then you know that her fertility is coming back.
Thank you very much. Anybody else with a question, you can put your hand up or you can type it down there in the chat. If there is a question.
I see Catherine has written a question.
Okay, yeah, Catherine has written, why do doctors perform fibroaneectomy in place of TL without patient consent? Someone was told TL was as you showed in presentation.
Okay, what I know about is tubal ligation and fimbroectomy. I'm not so familiar with it, but what I know is that some women have been actually, this has happened in the past, where tubal ligation is performed without patient consent when the woman is under general anesthesia, and that is very wrong. So it should never be performed without patient consent, and fully informed consent is with full knowledge of the adverse effects, as I've explained to you before. Fimbroectomy, I guess, is removing of the fimbriae, the fingers and the sides.
Okay, thank you very much. I don't see another question, and nobody has a hand up. Somebody asked earlier if they can get the presentation. I don't know if you want to comment on that. I said I can see it's over 100 slides. It could be carrying much more than what you presented. And I don't know whether you would be free to share that, but you can comment on that. The other thing is maybe you will put your contact information in the chat for anybody who would like to consult you any further beyond this evening.
Okay, let me do that right away.
Thank you. Yeah, I can see you put it. Thank you. So I think we can have probably a vote. I can see Chris here. Chris, I don't know whether you would like to say something. I know this is also your domain. You can unmute and make a comment, and then we close. I will ask Catherine to give a vote of thanks afterwards. Yes, Chris?
Hi, OPP.
Hi, how are you?
I hope I'm audible enough.
Yes, you are.
Thank you. Also, I want to thank Daktari for the very exceptional presentation. That was very comprehensive, actually. And we are just listening here. We are listening here with my wife, and while she's nursing the little one. Now, what I just want to say is that I've noticed most, as Daktari has said, most of the women, these contraceptive effects, they affect them till most of them go with the effects till in the grave. I know of a woman who was using the Provera for almost 8 years, and she stopped, and now she teaches NFP. But up to now, she had an effect with the brain. The Provera affected the brain. So up to now, she's still taking medication after 15 years of stopping using contraception. She's a mother of 9 right now. She's using NFP. So up to now, she's still taking medication even after using NFP for 15 years. It affected the brain. So I think it goes a long way for women, for all these things they put in their body, knowingly or unknowingly. And it still affects them, and also their marriages. And I've always asked myself how, because the couples we meet who are using contraception, 90% of them, their marriages are living hell. So I've always wondered how married people say they are happy or they are doing well while they are contracepting. I've always wondered that. Is rarely have I found any couple who are contracepting and their marriage is at least growing and they are growing in virtue and growing in love. Very, actually, I found no couple. It's very ridiculous. So these effects, I will want to say, they affect even the man. And nowadays, even they are discovering even the environmental. You're getting transgender fish because of these sewages. They are going to all these chemicals, the synthetic. They are going to the sewages. People are ingesting all these water from these oceans and also the fish, because since they're injecting too much progesterone and just into their system, so they are becoming transgender, even the fish. So you should be very mindful of what we are eating nowadays around. So again, also another thing also on arthritis. Most of the arthritis is caused by the provela. Most of the women, if you not all, but most of the women and most of the osteoporosis. My father was an orthopedic technician, an orthopedic doctor, and he noted that in his practice, most women who are using the Depo-Provera, it affected even their ovulation, it affected their system, it affected their bones. They had weak bones, so they were having fractures often. So these things they affect women all around, and they're very disastrous for a woman who should be nurturing and the pillar of our societies, nurturing children, undergoing all these effects, and the man is there.
Yeah.
Is there promoting the
Very
use
true.
of these. So that's what I can add. Otherwise, Daktari, thank you. We continue educating more couple. Actually, today I got a call from a couple who saw my article and they want to learn NLP, and I was very happy. They have used all these contraceptives, they have given up, given up on them. So
Thank you very much. Thank you very much for sharing. Actually, yeah, because like you see, we're made of body, mind, and spirit. And the marital union between husband and wife is sacred. It's not just a union of bodies. It's the whole body, it's the whole mind, it's the whole spirit. And it's supposed to be a totally self-giving act. Like the whole marital union is supposed to be a self-giving act. And so the minute you're using a contraceptive to block the possibility of a life-giving act, then you have negated the whole purpose of the marital act. And it's supposed to be totally open to life, even if you're using the days where you're unlikely to conceive. So the minute you make it for pleasure only and not the life-giving act, then you negate the purpose of the union. And so it's like telling a lie with your body. And people, you know, it doesn't resonate well with the body when you tell a lie. So it's like you're saying your body, the act is saying that I love you unconditionally, but actually you're lying because you're saying I love you, but without your fertility. So you find that once you bring that selfishness aspect, then the couple are not totally giving one another, and they actually know that something is wrong. And so the couples who are contracepting, you find that the woman especially is the one who's being used as a sex object. And when they come to understand this, you know, you're only supposed to be fertile for 6 days, but you're swallowing something every single day. Or the husband is using a condom on you every single day. So he's just using you as a masturbatory object. And people usually take things for granted when they're available every single day. So there's no quality there, you know? And that is why you find such couples, they cheat on one another because there's something missing from that uniqueness of the relationship, which is actually supposed to be a prayer. It's a very beautiful thing. And Yeah, I think more and more people are coming to discover, because even people who are having adverse effects of contraceptives, and so they had to use natural family planning, and they're not even Catholic. It was not a religious reason. They found that their marriage, the quality of their marriage was so much better because the man was not taking his wife for granted. They were communicating about the cervical mucus. I mean, surely if you're communicating about the state of your cervical mucus, is there anything you can keep a secret, really? That is such an intimate thing you're sharing. Eh? So they become much closer, and the woman we feel cherished when somebody is, concerned about what, whether we're ready for another baby or not, and whether he's ready to wait. So that brings in the self-control aspect, which makes the day that you're actually meeting in a marital embrace, it makes it much, much better. The quality of the relationship and the quality of the intimacy. Intimacy is not just about sex. It's about sharing. It's about knowing intimacy, knowing the deepest part of me and my heart. So yeah, it really has a psychological, a spiritual aspect to it. And many more people are coming to realize the beauty of natural family planning. And the women are being empowered to understand their cycle, and then being in touch with themselves and understanding the subtle changes from day to day, because women who are in their reproductive phase are not the same yesterday as today and tomorrow. So she's able to say, today I'm ovulating. In fact, that point of change where the woman starts noticing the makamasi, like we call it the voice of God. God is whispering in your ear, you can become a mother anytime. So the woman is completely in tune with her body, and that is really, really empowering. She knows what hormone is working at what particular time. Because of her cervical mucus, she knows what hormone is working. So it's a very beautiful thing, and she's communicating with her husband about that, and he's in tune with her cycle. And then the mystery of the woman really is so beautiful to the man. It's not that she's just swallowing something every day and she's sterile every day. That is not how it's supposed to be.
Contraception very early. The dangers about them need to be known. And I also hope and pray that people can speak out more on the effects of these contraceptives, especially the tubal ligation. I actually know of this issue where the fimbrectomy is done, and when one is now regretting and trying to reverse it, there's nothing that can be done. So there's also the mental issue that comes out of that. I hope this information can reach so many so that people make better informed decisions based on the real truth that is usually not shared. Thank you so much. And
Most
let us
welcome.
pray.
Thank
In the,
you.
name of, in the name of the Father, Son, and of the Holy Spirit, amen. God, we thank you for this session where we have shared lots of truth based on the science and our principles as Christians following your word. We thank you for our speaker who sacrificed so much to share with us for the past hour and a half. We pray that you may be agents of change by sharing this information to many, that you may help so many to avoid having gone through the same potholes many already have. And we pray for healing for the many that are suffering for so much that they have gone through because of misinformation. We pray for Linda Vijana and all its partners as we continue to help the young and the teen and even the older who are trying to make their lives